Our next presenter looks at things from the visual analytics side and the actual applicability of EHRs. So for those of you who were witnessing Senator Frist speak this morning, you got to see what an EHR looked like and what an actual patient record looked like, and it's a jumble of information and it's very incomprehensible and it just looks like garble. So what this person has done has actually created a visual analytics platform that at the point of care allows you to pick the most important information from the EHR and apply it directly when the physician is seeing the patient. So I'd like to introduce Ketan Mane, who's from the Renaissance Computing Institute at UNC Chapel Hill. Let's give a hand.
Hey. Thank you. Hello, everyone. I mean, it's been an exciting conference, exciting initiative by Todd Park, Arnab, and everyone. We had great presentations earlier, and we are kind of trying to, from our side, trying to add the drop in the bucket about how we could make use of all this data. And right now we are kind of putting in how do we bring all this EMR data, which is rich at the point of care through a data-driven approach. So beginning with the presentation, let's see, we kind of come across interesting titles from time to time. Like this one, doctors are the third leading cause of death in US. Now, the article's based on the study by Dr. Barbara Starfield, and if you look at, and it's been published at JAMA, if you look at purely the numbers, it's 250K, 250,000. If we, that's next to heart disease and cancer. If you break it down, if you look at the causes and break it down, 42% are due to adverse effects of the drugs, 5% are due to unnecessary surgery, and 3% are due to medical errors. Now, that brings out to the number 50%. Now, 50%, that's too high. Can we do something about it? How can we do something about it through informatics, especially in the era where we see that a large amount of patient data has been collected. Now, this patient data which is collected is rich in information, rich with treatment data, outcomes data, all comorbid conditions and other things. But at the same time, we have to account for the fact that doctors' patient-to-physician time is constantly on the decrease. So we have to kind of make use of the 5 minutes or 10 minutes time which we get with the doctors and empower them to give the best treatment options. Now, so there is a classic case of information overload here. You have the huge amount of patient data. At the same time, you have the decreasing amount of time. So can we empower doctors with external aid to process this information? So at one end of the spectrum, we have the doctors. And on the other end of the spectrum, we have this rich human EMR data with all the patient diagnosis, treatment, and outcome information. But there is a big gap in between. And doctors are known to practice based on anecdotal evidence, based on prior experiences. Now, in absence of this evidence, there is no feedback mechanism for them to kind of know whether their treatment is going to work or not. So how do you bring all this EMR data, which is rich in all these different factors and information at the point of care? But there are some key issues that need to be addressed, such as information overload. How do you kind of channelize this information to the point of care? Similarly, how do you make sense of all this retrospective information which is stored in EMR and bring it from decision-making point of view? How do you take all this information and personalize it? How do you contextualize it? And all this boils down to if you can make sense of it in real time. So the doctors can choose the best treatment options which are available to them and make sense of and give you that right treatment. So it all boils down to how do you make this raw data into something which is actionable, which they have been talking about right from start. So again, raw data to actionable, raw data converting into information to something like knowledge. And in this process, just selecting the subgroup of patients who are similar to your patient isn't good enough. Can we make it more actionable? Just displaying the longitudinal information of the patient is available, but can we do more than that? Can we bring in more power? So we think that visual analytics layer can be a layer which can bridge the gap. So what visual analytics could do is it could aggregate the information, summarize it, and present it to the user or the clinician, and also help identify more information from this EMR data set, such as can we identify if my patient is not responding to treatment, what are the other alternative treatment options which are available to me? Similarly, based on similar population data, can I derive predictive insight from this data about how my patient is likely to respond to other alternate treatments which have been selected? And again, it all boils down to how I can make it more patient-centric, how I can make it more personalizable. So we worked with a clinician at Duke Psychiatry Department, and he made us available this data set on MDD, a major depressive disorder. And it boils down to he was interested what we could do with the data set. So we tried to create a visualization where we could aggregate all this information, and using the visual data analysis principles, we came up with this dashboard, which aggregates all this information into one particular UI. Essentially, at the top, you see the doctor at a glance can see what demographic information what is my patient demographics like, what are the comorbid and other conditions, what is his primary diagnosis. Over here, you can get at a glance view of how has my patient responded to different treatments which were given to him in the past. Basically an overview of his longitudinal data, longitudinal historical past. And then based on population data, we kind of do some predictive analysis as well as determine what are the other options which are available for the doctor at the point of care. So essentially we kind of figure out what are the different medications which the population data has, which the similar population data has been, similar patient population has been given, and and over here we kind of show how is my patient likely to respond in 30, 60, 90 days in advance. In addition to that, we have filters which can narrow down the population based on demographics. So let me give you a quick demo of this application, and I can just voice over this as the video plays itself. So essentially, you have the same UI which is available to you, and let me just quickly start it again. So you have the UI available, and you see the longitudinal information. You have the other treatment options and the predictive model, predictive analysis about how my patient is likely to respond. If you see, if I select a different medication, my predictive modeling prediction changes. Similarly, if I have no information available, that it doesn't display over there. I could go into further stratification of my population by selecting filters. Now, here we have filtering based on demographic information. You have based on medication class as well as on the comorbid conditions. And I could instantly kind of filter the displayed information based on if there is by excluding a certain med class level. Here I excluded MRT and RIS, and I could add it subsequently. Similarly, I could narrow down the population based on comorbid conditions, just exclude them on the fly. Here we have how do we exclude eating disorder. again, based on filtering based on demographic information, you could just narrow it down based on the female population, which is more focused on, which is more targeted towards what your patient is. And then you instantly see that the recommended list has been narrowed down from 5 to 4, and push that off, and push the, and once you have it available, you could just remove the filtering of the filtering thing off the screen, and there you have it available, the information which you needed on the screen. So that was just a quick demo of what we could do with all this information which is available. So in a sense, we kind of, in addition, just to summarize this whole thing, in addition to showing patient longitudinal data, we kind of put forward an approach how you could use the EMR population data at the point of care by giving a more patient-centric solution, allowing the doctors to see what other options are available on the table in terms of the medications, and also give them some predictive insight about how my patient is likely to respond in 30, 60 days, 90 days in advance. So thank you for your time, and I'll be happy to take any questions. Thank you.
Thank you.